Hey everyone, I want to give you an update on a couple of things that we found out this week. So on Monday morning, I got an email to call and schedule two tests. One is an echocardiogram, and I've got that scheduled for September 30th. And then I also have a stress test scheduled for October 7th. And so I was really praying, I'm like, Lord, if we could have this surgery for my brain scheduled after these tests, that would be very good. That way, if there is anything wrong with the heart, we would kind of know that by then. But I was really unsure. So I got those two scheduled. And then Monday, I started my sleep study. And again, that's a ring that you wear. I actually wore it on my pinky. And I wore it for 2 nights. And you start it right before you go to bed with your phone. And then, of course, when you wake up, you turn it off. And it electronically sends things in. And so I got a call today from my doctor here in Augusta, and they said, Scott, you have sleep apnea. And I'm like, you've got to be kidding me. And that explains why I've been so tired for so many years. I could sleep all the time. And it doesn't matter how much I sleep, I still feel tired. And so now I know that I've got sleep apnea. I'll have to be fitted with a CPAP machine more than likely, which should happen hopefully in the next week or two, get suited for that and start on that. And hopefully that will make me feel more energized because again, I am always tired. I can sleep any time of day and I can still sleep at night. Doesn't bother me. So we got that news today. Yesterday was a hard day. I've been waiting for the last week and a half for the hospital in California to call me and try to get me in this year. And she told me it would be about a week or two. And it's been about a week and a half. And yesterday, I think this thing with Charlie Kirk, and I just was done being patient. And I had to go back to the Lord and say, Lord, help me be patient and wait on your perfect timing. And lo and behold, today I was in a meeting a little after 5:30. And remember, California is 3 hours behind us. So the lady called, the scheduler called, talked to me and said, Scott, we've got a date for your surgery this year. And it's December the 9th. So that's going to be our scheduled surgery date for my brain tumor to be removed. We will need to be there the day before at least for pre-op. And so now we're in looking at different options about when we get there and when we fly back. She did say that post-op would be December 17th because you do need to stay near the hospital around 8 days or so. So with the surgery being on the 9th, the 17th being our scheduled post-op, hopefully we'll be home the 18th if things go well. That's the plan. And so there's been a lot that's going on. So I still have the 2 tests for the heart. And so that's what I want to ask you to pray for. Of course, if there is a blockage, we do want to know that, even though that would push that surgery back into next year sometime, probably 6 months to a year. You got to get the heart seen about if that's the problem. But of course, if the Lord could see fit not to let there be any heart issues, that way that the surgery could go forward on December 9th. So I'm relieved, I'm excited. I have a date in the sand, so to speak, where I can kind of hang my hat and kind of work toward that. The good thing about all of this is, I'll be able to hopefully rest better with a CPAP machine. I'll be able to make sure my heart's checked out. And I get to hunt like 2/3 of the season. So I am extremely excited about that. Hunting season starts this weekend, for those who wanted to know. And so I'm excited that I'll be able to also hunt. But I'm also excited that, Lord willing, the surgery will happen in December this year. So a lot of that will be covered by insurance since we've probably pretty much met our deductible already with all these other things that have transpired. The other thing that happened last night, kind of unexpectedly, is I went to trim up my hair and I grabbed one of the things that I thought was the right size for my trim blade. And once I went, I realized it went to the skin. So now I am clean shaven pretty much. They would probably have to shave me anyway for my surgery, for my brain surgery, at least back there where the surgery is going to be. But I decided to get a jump start on that. So I'm trying to get some tan because I'm really white on top. So that's another exciting thing that's going on. But other than that, not a lot's going on around here. So thank you again for your prayers. I'll try to keep you updated once we get past these heart tests and keep you updated. But if you'll pray for me in that way, I'd really appreciate it. And if we could get it in this year, that would be awesome. Thank y'all so much.